Good afternoon, Commissioner.
Good afternoon.
I'd like to warmly welcome you on my behalf, on behalf of the European Public Health Alliance and our audience here today as well, to the 8th annual conference of the European Public Health Alliance entitled Make Health Your Business. I'd like to, if you agree, come straight down to our questions.
Okay.
According to the latest Eurobarometer, which I'm sure you're familiar with, 70% of Europeans actually want more EU action on health. What are your plans for the coming period to show the added value of EU action on chronic diseases?
Okay, first of all, it sounds like music that more than 70% people are very keen on health issues. As a commissioner responsible on health, not on sicknesses, I would like to be very proactive on promotion, prevention, protection of health issues, addressing all determinants, social, environmental determinants in health, biological, behavioral determinants, fighting risk factors, curbing risk factors. Of course, fighting against market aggressivity, which has a lot of risk factors on the ground. And on the other hand, how to help people to understand that chronic diseases also they have good opportunity to reduce number of chronic diseases. And here we are very keen to promote joint actions at EU level. Why we are just doing, studies of state of health of the EU, keeping in mind possibilities of clear picture of all member states of status of health of their populations. And of course, also, we need to see possibilities to develop our analytical capacities, to help member states to have healthcare systems more stable, more resilient, and more accessible to people.
But what type of vision, leadership, and action are needed from the EU to achieve the NCD reduction target under Sustainable Development Goal number 3?
In all goals, you have a health component, not only in number 3.2, but in all. We need to introduce health in all political sectors approach, doing with all Sustainable Development Goals. We have a lot of targets, including legislation, yes? It's about tobacco, for example. Of course, speaking about funding instruments, how to encourage member states to allocate funds, achieving their voluntary and accepted targets together with different DGs. And of course, we are acting in this way, cooperating horizontally.
Thank you, Commissioner. What is the role for you of the EU funding programmes, including the health programme, to unlock investment in health and to act as a powerful multiplier?
We have European structural funds. And here, in European structural funds, we have a lot of money dedicated to health sector and dedicated to prevention issues. In 2014, 2020, we dedicated more than 9 billion euros supporting member states. We need to understand, when we look at budgetary composition, we see that sometimes prevention is very last. Of course, we know that prevention is better than cure, but why in financial terms we see that in prevention you see a lack of financial instruments, and it must be changed. We must once again to send message to our governments, our member states, to European Parliament, discussing new multi-annual financial perspective. We need to strengthen our financial capacities to improve more prevention area.
Thank you. Now, we know that action from local and regional authorities is often leading the way in terms of public health initiatives and promotion. How do you see the role of the EU in relation to that of the local and regional health authorities?
Really speaking, all our life is at local level. And all our people understand European Union better if they see added value at their living community area, at local level. Sometimes it's strange to see how to bring European Union closer to citizens only through local activities. It means that local communities, local municipal councils, mayors, local politicians must be advocates, must be ambassadors of local health issues. And of course, I would like to draw your attention on European Innovation Partnership on Active and Healthy Aging and its group of on integrated care. It's a very good instrument which combines regional and local activists together, introducing concrete local programs.
What do you view as the role of civil society in advocating for better public health and better health policy?
Openly speaking, I'm very happy that I have a lot of my friends, a lot of NGOs around me. Why? Because at European Commission level, it is only a real instrument which can help us translate so-called high ideas into real life. Second, they have good opportunity to control situation on the ground. And to criticize me, of course, it's I am very happy because those constructive critics helps me to understand where I am. May it will be better to join our forces and to create common calendar and raise our strongest voice. And of course, speak about effectiveness of our actions and continuity and sustainability, cooperation of NGOs is very important because we know very well we have lack of human resources, lack of financial resources, like always. I'd be more than happy to see much biggest amount of money in our health program. We need to join our forces, acting against horizontal, against general main risk factors together. Alcohol, tobacco, trans fats, sugar, salt, physical inactivity, stress management. All those factors are acting together. And it would be good to join our forces presenting guidelines generally, asking member states to do more and drawing attention on a health in all policies approach, because this narrative is very, very weak.
Or could I finish off with before I thank you, an invitation to you, Commissioner, then I invite you on behalf of the European Public Health Alliance in our next interview next year, whether it's live at the conference or here in the studio, to bring a couple of your fellow commissioners with you from other policy areas.
Yes, we need it. We need to do it.
Well, let's start a trend together.
Yes.
I'd like to warmly thank you on behalf of the European Public Health Alliance and myself as the moderator as well for your time today in joining us here at the conference virtually as you couldn't be with us. Thank you very much, Commissioner.
Thank you so much. Thank you so much.
You're welcome. My pleasure.